Hey guys, welcome back. We're going to now go through the content scales of the MMPI-2 in this video and cover some of the content categories that you're going to come across in your interpretation or your profiles, as well as that you may come across in your client profiles as well. So let me share my screen with you here. So these are the content scales. For these, you guys, I've got them presented combined on two different slides, and so you'll be able to, we won't have to go through as many scales. So the content scales are kind of cool, actually. They're a little more specific and obvious in terms of their um, the different scales that they have, and they line up a little bit better with modern day notions that we have in current mental health care. So some of the information or some of the categories may be kind of DSM-ish. The others are a little more, they're things that we may talk about in terms of stuff that clients deal with. So the labels that they'll use are a little more explanatory than the clinical scales that we went over earlier in your previous video. So the content scales were developed by selecting items that are more obvious in content and a little less mysterious. So they're a little more transparent and measure what respondents basically wish to communicate. So with that, it's a little clearer in terms of content validity, what it is that people are trying to communicate or what they're reporting on. They're a little more obvious about categories and symptoms. So you have to be careful to interpret the validity scales then prior to interpreting these scales. Because these scales are kind of transparent, the validity scales of either faking bad or faking good are really going to impact these scales. So be mindful of that. High elevations, you're looking at 65 and above, and mild elevations might be 60 to 65, but just be mindful that you want to look at things greater than 65 and make sure that the validity scales are all kind of within reason. So here are the content scales specifically. The first one is the anxiety scale, or the ANX scale. High scores, you're looking at what we know anxiety involves: tension, worry, fears of losing your mind, lack of confidence, and even body indications or somatic indications of anxiety, like my heart's pounding and shorter breath and sleep problems and the rest of it. This scale correlates or is related to the anxiety scale in other parts of the assessment. It's also highly related or correlated with psychasthenia, and it's also highly correlated with the depression scale. Okay, the next one is fears, the FRS scale. These are specific fears that this particular scale is gauging. So things like phobic kinds of concerns, snakes, high places, you know, blood. You get weird ones too, fires, storms, dirt, mice, money. That's interesting. Fears of leaving home, fear of water, and even fear of being trapped or fear of being confined, for example. That's what the fear scale is catching up, getting into. So it's getting into anxiety in general, but more of the phobic kinds of things. There's a specific thing that folks are fearful of. The OBS scale is the obsessiveness scale, and this is looking at obsessive tendencies. And this is a good one to use because it's focusing on ruminating. And it does do a little bit with compulsions around counting, saving things that are not important. But it really gets into the inability to control or to stop your thinking. Specifically over things that are aggressive or things that are more forbidden or whatever. So it's looking at obsessive types of issues. That scale's highly related or correlated with anxiety and psychasthenia, as well as in the anxiety scale. The DEP scale is the depression scale. That's looking at severe, or what DSM calls, the DSM calls major depression. So it's looking at brooding, you can cry easily, pessimism, suicidal ideation, guilt, remorse, being sensitive, apathy, feeling worthless, unresolved losses, for example, and feelings of emptiness as well. HEA is health concerns. And specifically, these are looking at gastrointestinal symptoms, neurological symptoms, problems with sensory issues, skin problems, dermatological problems, pain, and respiratory problems. The BIZ scale is the bizarre mentation scale. And this is looking at things such as paranoid ideation. It's looking at things like ideas of reference, delusional experiences, derealization, thought intrusion, and hallucinations. So these are for people who kind of recognize that their thoughts are strange or thoughts are peculiar. So you can have bizarre mentation at a high level with folks who are judging their thoughts to be that way when they may or may not be that way. Okay, so those, let's see, 6, anxiety, fears, obsessions, depression, health concerns, and bizarre mentation, that makes up what are called the internal symptomatic behaviors portion of the content scale. The next portion deals with what are called external aggressive tendencies. And so there's the ANG scale, which is anger. And that's the fear of or actually losing self-control over impulses or aggressive impulses. Irritability, impatience, stubbornness. It gauges people who have physical or verbally abusive behaviors and maybe like explosive types of behaviors. CYN is cynicism. These are folks who are more cynical in terms of being hostile, suspicious, and that they interpret people as being manipulative or being incompetent or dishonest and unfair. These folks will feel misunderstood, distrustful of others. They'll be exploitive in a rationalized sort of way because they think everybody else is exploitive. They're going to be exploitive first. Because you have to survive. It's kind of justified. Unsympathetic, selfish, grandiose, envious, judgmental, those kinds of things. ASP is antisocial practices. These are anti-authority kinds of thoughts. These are rationalizing and identifying with criminal behavior or behavior that's deemed inappropriate in society. These folks admit to antisocial or unlawful behaviors like stealing or acting out, dishonesty, selfishness, exploitiveness. Interesting that none of the items are associated with a violent behavior. So these are primarily with nonviolent kinds of antisocial types of practices, which is why they call it practices rather than personality. The last one on the external aggression tendency is the TPA or the type A category. So this isn't the typical notion of type A. This is getting more into more the negative side of type A, or folks who are having high levels of type A, where they're impatient, they get easily annoyed with other people who interrupt them, and so they kind of value their own connection over social relationships, or they're themselves over social relationships. These folks are hard driving, they're task oriented, they can be vengeful, they're not socially engaged very much, they're not fun, they don't joke, they're serious. So typically are rigid, they're envious, hostile, competitive, insensitive, they have a hard time waiting in line. They can be workaholics and demand others to be workaholics in order to be successful with them or be accepted by them, demanding, always racing. And that's the type A perspective in the content skills. The next one is low self-esteem, and that's kind of a self-view perspective on the MMPI content scales. So low self-esteem is similar to what you might imagine. these are people who don't like themselves very much, nor they could imagine then other people liking them. So they feel unattractive, they feel useless. You might feel a little clumsy or inadequate, unassertive, um, a low self-confidence or no self-confidence, uncomfortable with positive feedback, oversensitive, dependent, confused, those sorts of things. Then you get into the general problem areas of the content scales. That's the green bar. And there's 4 of them with that one. And that's dealing with SOD, which is social discomfort. So folks who have social discomfort usually are introversive, they're shy, socially avoidant. They don't like crowds or parties or group activities, and they'd rather be by themselves. Kind of hard to get to know. FAM is family problems. These are people who are reporting family as being unsupportive, unloving, maybe with a good deal of aggression, rejection, hostility. There may be indications of verbal abuse or physical abuse. They may be reporting their marriages as being unhappy, or feelings of jealousy, or struggling with resentment, and then a wish to avoid family members, perhaps. WRK is work interference. So these are folks who are having difficulties concentrating, they're having anxiety, tension, pressure, low self-confidence, lack of support systems. They're indecisive about things like career choices or decisions to make within their job. Negative attitudes towards others. So they'll have conflicts with authority, not to a rebellious nature, but where there's sort of a internal gripe or a disagreement, and they kind of hang on to that. And they don't really get past it. They may lack initiative, impatient, unorganized, lack of confidence, confused occupational goals. They might just be tired and burned out. Kind of avoiding responsibility, and maybe slow paced. And that might be related to passive aggressive tendencies. So that's what that work interference is getting at. TRT is negative treatment indicators, and that one's for gauging folks who may not have a positive response to therapy or even just general health care. So these are folks who may have negative attitudes towards doctors or towards counselors. They're pessimistic about being understood or others being helpful. They may not feel comfortable in self-disclosing. They may not feel comfortable with change. They typically are kind of pessimistic, and they have a low tolerance or a low frustration tolerance. So you'll experience things like defensiveness. They won't trust you. There might be some indecisiveness about them. They feel like, what happens to them now and in the future is more an attribute of luck, and they'll avoid responsibility for their own actions. They'll report an overt dislike of doctors. They feel they can't change their faults, and would rather just take a pill than talk over the problems. So they might believe too that, and this might be a cultural piece to it, with as well as just personal belief, but they may believe that mental illness is a sign of weakness rather than a legitimate need, or something that can be changed or worked on, or improvements can be made in. So they may have anxiety, a low morale, and might be a little high on the psychasthenia or obsessive compulsive side of things. Okay. So that's the content scales. What we'll go into next is the supplemental scales. And I'm going to go ahead and keep it in this video, since this video ended up being kind of short. So let's go there next. The supplemental scales, I'll put them all together here for you. And again, you're looking for a cutoff of 65 or greater to address that issue. Okay. Yeah, so the first one is the A scale, and that's for anxiety. And this is a person, again, who's upset, maybe shy, retiring, insecure, low self-confidence, difficulty making decisions, and the like. The R scale is unique to the supplementary scales, and that's a repression scale. So what that means is that these folks tend to be kind of submissive. They're overly controlled, either internally and also externally. Maybe slower, They have clear thinking. They're more conventional and formal. They're more cautious, but they'll use denial and rationalization to kind of hide from things inside of themselves, or they'll go to great lengths to avoid unpleasant interpersonal situations. So they'll be conflict avoidant. These are the stuffers, if you will. They just kind of just don't go there. They don't get into things that they think will be stressful. So that leads to decent coping in the moment, but it doesn't lead to very good recovery from things. And so because they have a hard time working through stuff, they tend to avoid and sublimate and repress and suppress and that kind of thing. The ES scale, or the ego strength scale, assesses the degree to which a client's likely to benefit from psychotherapy. But it's probably specific to predicting the response of clients to more psychodynamic forms of therapy. So if you're kind of overly defensive and you have high anxiety, so you're kind of neurotic was the old term that we might use. Insight is probably going to not have a big impact on you unless you work through those defenses. So it's probably not useful for other types of treatment as a gauge for the types of treatment. So if you're doing more depth-oriented or relational therapy or psychodynamic or formal psychoanalytic, this might be a scale you would look at to consider. But these folks can benefit from therapy, though, because they're likely to be adaptable and possess personal resources. So if you're dealing more with reality stuff, so cognitive interventions are better with folks who have this issue. They have good ego strength, they're tolerant, they're balanced, alert, they kind of have a secure sense of reality. And they'll seek help in difficult situations. So good ego strength basically means you're going to have good outcomes to all kinds of forms of therapy. Low ego strength means you're probably going to need more, concrete cognitive kinds of interventions. ACT is a very good therapeutic technique for folks who have lower ego strength as well. Okay, so the other ones, the DO scale is dominance scale. That deals with someone who's self-confident, realistic, they're task-oriented. They feel a sense of duty towards others, and they're competent to solve problems. They kind of take initiative in things and persevere and have a good ability to concentrate. So supplementary scales, they're not just looking at limitations, they're actually looking at strengths. So the RE scale is responsibility scale, and that suggests that the individual possesses high standards, a strong sense of justice and fairness, strong adherence to values. Might be a rigid adherence to values. They might be a little too rigid, but you'd have to gauge that with each individual. So they're dependable and trustworthy, and that's a good general index of positive personality characteristics. And it's also useful, often used in personnel screening. Let's see, the MT is the college maladjustment scale. And here is a kind of a negative scale rather than a positive scale. And this is looking at general maladjustment among college students. So if you've got high maladjustment, you're likely to be worried and anxious and procrastinate, and you might be pessimistic, somaticize your stress, and feel that life is kind of a strain much of the time. The PK scale is a post-traumatic stress disorder scale, and high scores kind of indicate emotional distress, depression, anxiety, sleep problems, guilt, obsessiveness, and feeling kind of misunderstood or mistreated. That doesn't determine, though, the scale doesn't determine that trauma has actually occurred. So it's not asking questions about their history or if they've experienced trauma. It's just giving you some of the symptoms that could be indicative of trauma. So you have to go in and ask questions about if they've ever had a traumatic experience that relates to some of these symptoms that the scale is picking up on. MDS is marital distress scale. That's indicating whether the person's experiencing distress in their marriage. And that's related more specifically to marital difficulties. So MDS should be interpreted only for people who are married, partnered, or in a significant relationship, or separated or divorced as well. So the distress still shows up as it relates to partners that they're separated from or that they're divorced from. The HO scale is hostility. High scores are characterized by being cynical or mistrusting, suspicious, unfriendly, and angry. However, they may not express their hostilities overtly. So they're likely to perceive other people as being hostile and to blame others for their problems. So there's this sort of externalizing projective thing going on. Um, and with that, they'll typically have low social support. So they have poor self-concepts. They don't feel a lot of support in the community, kind of feel like they're on their own, and that may relate to their hostility that's being expressed overtly or covertly. Um, so they may have anxiety, depression, somatic problems, and may even have serious health problems as well. Okay, we're getting down to the end here. Supplementary scales for the next section. Over-controlled hostility is the OH scale. And that's suggesting that the person's emotionally constricted, bottled up, anger. They may be, overreactive, so they get triggered and they kind of blow up, possibly becoming physical or verbally aggressive. Now, this is getting at physical and verbal aggression, this scale is. Um, uh, the aggressiveness usually occurs as a rare incident, though, who is otherwise extremely controlled. So this is the person who takes it and takes it and takes it and takes it till they can't take it anymore, and then they blow up. This isn't a person who's chronically abusive. This is more of a volcano type of individual. So this is scales useful in helping us understand past behavior rather than predicting future hostility. So some people who score high are not actively struggling to control dangerous hostility, but are very well controlled and highly socialized. So the scale is more directly a measure of persons who deny aggressive actions and are somewhat constricted. Um, Therapy, at least initially, might seem superficial and lacking in effect for people who have this because they may not be acting this stuff out in the moment. The MAC-R scale is the McAndrew Alcoholism Scale revised, and that scale is best considered a measure of the potential for substance abuse. Now this one differentiates between folks who are in psychiatric outpatient with alcoholism and psychiatric outpatients who do not have alcoholism. And it identifies people who are at risk of later developing alcohol related problems. So the potential to become involved in alcohol use is assessed, not their current alcohol use. So if you get a high MAC-R scale, this is somebody who could turn to substance use at some point. Um, the high score also can look at things like extroversion. It points to things like confidence, assertiveness, risk-taking behavior, potential, sensation seeking, some past school problems, and the possibility of having experienced blackouts in the past in terms of substance use, and possible difficulties with concentration. So um, the MAC-R is not particularly effective with certain racial groups and diverse groups, specifically African American groups. So be careful with the use with ethnic minority respondents. You may be gauging extroversion, more impulsive emotional exchanges or demonstrative kinds of interactions. That's different from folks who are like in the dominant culture perhaps, or the majority culture, who may have the scale may have been more normed on. So all right, down to the last ones here. I think that's the last one. Yeah. So the last ones here, the AAS is the Addiction Acknowledgement Scale. High scores suggest a conscious awareness of and willingness to share information related to drug and or alcohol related problems. This is the most sensitive MMPI-2 scale for detecting substance abuse. So the APS is the Addiction Potential Scale. And this high scores indicate that the person has a considerable number of lifestyle and personality factors consistent with those who abuse drugs and alcohol. So the scale doesn't necessarily measure the extent of current use, but more the potential, similar to the MAC-R scale, for developing the problems. So it means that if the APS scale or the MAC-R is used to identify persons who are actually abusing substances, it's likely to result in a higher number of false positives. So be careful with interpreting the APS or the MAC-R. Those are looking at substance use proneness, not absolute substance use. The AAS is getting more at absolute use, people who are disclosing that they're using. Let's see, the GM scale is the masculine gender role scale, and then there's a GF scale for the feminine gender role scale. And the GEM scale, the masculine scale, is this is gauging folks who score high, both males and females, um, that are likely to be self-confident, deny feelings afraid or feeling worried, and to be persistent in pursuing goals. Females scoring higher are likely to be more honest, unworried, have a willingness to explore new things, and the high scores on the GM scale here with corresponding low scores on GF indicate stereotypical male interests and orientations. High scores on both the GM and the GF suggest more that androgyny kind of characteristic where they have both masculine and feminine interests and characteristics. Low scores on GM, though, along with high scores on GF, suggest stereotypical feminine interests and orientation. And low scores on both suggest kind of an undifferentiated masculine feminine orientation. This scale, wanted to note here, is still experimental and is in need of further research. So be careful, along with the GF scale, about overinterpreting this. These are a little better than the masculinity femininity scale in the clinical scales, but again, it's probably getting more at people's stress responses or pressure people feel from the culture by them not showing up in gender stereotypic ways than it is about measuring any form of gender dysphoria, perhaps. But that still has to be fleshed out in research. So at this point, avoid that interpretation. The GF feminine or gender role scale, that's suggesting the endorsement of stereotypically feminine interests in our culture and orientations, and may also suggest religiosity and possibly abuse of alcohol and other non-prescriptive drugs, believe it or not. Just from the research so far. So be mindful of that. Involvement in church versus involvement with drugs, they tend to go hand in hand when you come to feminine gender role stereotypes. Male scoring high may be hypercritical, may have a religious affiliation, may avoid swearing but act bossy, and avoid or have a difficult time controlling temper or their temper. So again, that scale is also experimental and needed further research. So just be cautious. It's included in the MMPI-2 protocol, so that's why I included it here. All right, you guys. So with that one, what we'll go to next is we'll talk a little bit about critical items. And I think we're getting down to the end. I wanted to talk a little bit about interpretation as well. So we'll do critical items and interpretation, and then we'll be done with the next video.